Under the Care Act, local authorities are required to have oversight of their social care markets. The CQC also has a duty to independently review and assess how local authorities are delivering their Care Act functions. Within the health and social care sectors, the importance of provider quality, risk and sustainability is key. The challenges local authorities face demonstrating quality, clear market oversight and consistency, to name a few, has not been straightforward. Access PAMMS, Provider Assessment and Market Management Solutions, is our solution that has helped change the way teams work with the social care market. It supports local authorities, including regional networks, to meet their duties under the Care Act and gives them an evidence base to demonstrate during their CQC inspection. Meet John. He's the head of service for social care for a local authority. He struggles to provide the risk, quality and market data in a consistent manner with the wider audience, including directors, cabinet members and providers of social care. This is also applicable to Imran, who runs a large residential care service, and Jess, a quality and contract officer for the local authority, who both struggle with lack of consistency when conducting assessments. Each have to pull disparate information across the social care market together on a manual basis to present to senior stakeholders, which takes up a lot of time. They also worry about the stability in the marketplace due to challenging market pressures, including increased cost, a reducing workforce, increased demand for services, threat of provider failure, handback of contracts. Using Access PAMMS, John, Jess and Imran can meet their duty of care responsibilities and be ready for CQC inspection, access all quality and risk data through a single centralised dashboard, provide real-time market insights and analysis, including detailed analysis of costs across local and regional geographies, share information with the wider audiences, synchronise data from multiple sources to give an overview of the care market, accurately predict future demand from an individual and cost perspective. Within Landscape, users can see an overview of spend, activity, quality and capacity over time. These metrics help them visualise and understand their duty of care responsibilities in compliance with the Care Act. John from the local authority can access all quality and risk data through a single centralised risk profiler dashboard. This dashboard forms a number of data points across the social care market and tries to identify an elevated risk. John can also track the overall ratings of assessments for care providers and locations in his area. This helps him to understand how they're performing over time, both from a CQC perspective and against the local and regional outcome standards. John can access real-time market insight across a number of locations to help compare the performance of each domain criteria against neighbouring authorities. Filtering down by organisation and service type can quickly help John and Jess indicate the areas of most concern. Within the PAMMS Assessor platform, John has an easy-to-follow interface to make assessments and capture evidence from each provider. The completed assessment applies overall ratings to each of the measurable domains. Imran can access these assessments, which are publicly shared within the provider portal to help promote best practice and drive improvements. Local authorities can use and publish dashboards with joint disparate data from multiple systems to give themselves and the wider public an overview of the care market. This helps John to better support a digital market position statement. The demand model tool can help John plan and manage budgets. It provides tools that predict how many people may require social care in the future and what the cost to support those individuals is likely to be. PAMMS replaces any existing manual processes to quality assurance, risk management and market oversight by using a digital-first approach, including the sharing of information across local authority boundaries. It empowers local authorities to meet legislative requirements, generate savings, improve quality, support care providers, and develop a trusted relationship with a single point of truth. Most importantly, it reduces risk to service users. Access PAMMS. Freedom to make it personal.